Have you ever experienced a burning pain in your upper abdomen, especially after meals or even in the middle of the night? It might be more than just indigestion. You could be dealing with peptic ulcer disease, a condition that affects up to 10% of people worldwide. Let's break down what it is, what causes it, and what you can do about it. Peptic ulcer disease, or PUD, happens when open sores, called ulcers, form in the lining of your digestive tract. These ulcers are caused by corrosive stomach acids and enzymes, especially pepsin, breaking through the protective mucus barrier that lines your stomach and small intestine. Most ulcers appear in the stomach or duodenum, but in rare cases, they can also form in the esophagus or jejunum. In fact, about 80% of ulcers form in the duodenum and around 20% in the stomach. Strangely, up to 70% of people with ulcers don't notice any symptoms at all. But when symptoms do appear, the most common is epigastric pain, a burning or gnawing pain just below the ribs. It often comes with indigestion, bloating, nausea, or early fullness. After eating, stomach ulcers usually feel worse soon after eating, while duodenal ulcers often feel better after eating, but worse 2 to 3 hours later, or even at night. Some people confuse this pain with hunger, because eating temporarily brings relief. Left untreated, ulcers can lead to serious complications. They can bleed, causing black or bloody stools and even fainting. They can perforate, creating a hole in your digestive tract, leading to intense pain and infection. Or they can cause obstructions, blocking food from passing through. So what causes ulcers in the first place? Nearly all peptic ulcers are caused by one of two things. 1. A bacterial infection called Helicobacter pylori. 2. Or long-term use of NSAIDs like ibuprofen or aspirin. Both of these disrupt your gut's protective lining, leaving it vulnerable to stomach acid. Other less common causes include chronic illness, radiation therapy, or conditions like Crohn's disease or Zollinger-Ellison syndrome. If you're having symptoms, your doctor may recommend an endoscopy to look inside your stomach and duodenum and test for H. pylori using a breath, stool, or biopsy test. Sometimes imaging like a CT scan may be used for larger ulcers. Most ulcers can be treated with medication, including antibiotics to kill H. pylori, proton pump inhibitors to reduce stomach acid, cytoprotective agents to help protect your lining, H2 blockers to reduce acid production. If you've been using NSAIDs, you'll need to stop and may be advised to switch to something safer like acetaminophen. Serious cases may require procedures or even surgery to repair bleeding or blockages. So, how do you prevent peptic ulcer disease? Get tested and treated for H. pylori if you're at risk. Use NSAIDs only as directed. Avoid smoking, excessive alcohol, and foods that irritate your gut. With the right treatment, most ulcers heal in 4 to 8 weeks, and most people recover completely. But follow-up is essential to make sure the ulcer doesn't come back. Peptic ulcers aren't always obvious, but they can be serious. If you're experiencing symptoms or even subtle signs, don't ignore them. Talk to your healthcare provider, get the right tests, and take action. Because healing is possible, and your health is worth it.